Good morning, everyone. Thank you for joining us for today's webinar. Greetings from Amar Seva Sangam. My name is Selin Kumar in early intervention team at Amar Seva Sangam. This is our second webinar in enabling inclusion and child development webinar series. Today we are presenting family-centered care challenges and opportunities, stigma to empowerment. I would like to introduce our two speakers, Brien and Navamani Venkatachalapati. Brien is a pediatric physiotherapist and a clinician researcher based in Canada. She is Associate Research and Capacity Building Director for the Enabling Inclusion Program at Amar Seva Sangam. She has presented at many international conferences and published in peer-reviewed journals. Welcome, ma'am. Navamani Venkatachalapati is a pediatric physiotherapist who has over 15 years of experience in promoting mobility and function children with disabilities. She is currently leading the implementation of the Enabling Inclusion Program. I welcome you both. Mary, ma'am, it's over to you.
Thank you, Celine. And I'm pleased to welcome you all to our second webinar of our Enabling Inclusion Child Development series. And I am very pleased to welcome this morning Dr. Prachi Kaul, who is the director of the Shastri Indo-Canadian Institute. And she will be opening our session today. Welcome, Dr. Kaul.
Thank you so much. It's quite welcoming to see all smiling faces. Those I can see, those who have not switched on their cameras. I welcome all of you. I'm sure the excitement of this particular event is there on your face, and that will lead you to some very constructive efforts towards this direction in which the event is being organized. So thank you so very much, Barry and the associates, for having me here today, this morning. On behalf of the organization Shastri Indo-Canadian Institute, I thank you all for putting together this wonderful initiative, which is quite integral to human being, I would say. And in today's world, which is going haywire, we need more integrated learning that leads us to better future, because these kids, these children are our future, and they are enabler, I would say, for future. So anything and everything that concerns children becomes very special to all of us, and should be very special to all of us, and should be treated with care, and a lot more care, and requires a lot of efforts from our side. I thank you for having me here. Just to go back to where I come from, is an organization that operates on the bilateral domain of India and Canada. We are 53-year-old. 2018, we have celebrated our golden jubilee, and we are going strong. We are aging with grace, and we will say that that child that was there since inception is still there, but has become mature in terms of delivering goods to the fraternity from both the countries. India and Canada, I would say, are two great democracies of the world that have lots of commonalities and a lot of differences as well. But this, I would say, this particular event, which is being, in collaboration with Amar Seva Sansthan and University of Toronto, I would like to inform all the participants that University of Toronto is one of the founding members of Shastri Indo-Canadian Institute. We have now a network of 170 institutions across India and Canada. You name a good institution, it is there on board of Shastri. in its network. And what we do is we provide opportunities for our member institutions to come together and do something like what is happening today. And that's the beauty of Shastri programming. We not just fund, this is a small amount that we have granted for this lecture series, but Shastri grant and opportunities have a banyan effect, a banyan tree effect. I hope you understand that term, because it's a seed grant that is being given by us, but it leads to many directions. It leads to incepting of ideas and thoughts across these two nations and amongst the people who are interested in that particular aspect of life, or culture or science or technology or engineering or any aspect of our life that touches upon human being. So that is how Shastri reach out to the communities at large. We do not directly work with non-governmental organizations, but this is an ideal example how we tag along, to our researchers who are from our academic and research organization that are part of the Shastri network. We are mandated by both the governments, Government of India and Government of Canada, with two offices. One is in New Delhi, one is in Calgary in Canada. And I would say that the important role that we have been playing over the last 5 decades is bringing people together. And by bringing people together, I mean that if there's a scholar who goes to Canada or comes from Canada to India, they became automatically, very naturally, they become ambassador of each country for the other country. And the goodness of human-to-human contact, the person-to-person connect, is something that leads to their collaboration and partnership for the decades to come. So if you spend 3 weeks in India, it becomes that you are a friend to India forever, at least for 3 decades. And that's what our experience is. And that's why we feel proud that whosoever comes in contact with Shastri remains as a Shastri family forever. So I welcome Mary to you and to your colleagues to this Shastri family. We are looking forward to have greater engagement in future. Such a wonderful idea to navigate upon, because this particular aspect, as I said, is very integral for human being. And I strongly believe in integral learning, inclusive learning, and as well as integral learning, which inclusive learning is only possible when there's an integral approach to our education, and being conscious on what we are teaching, what we are learning, and what we are imparting is something that need to be dealt with a lot clear by us who are involved in pedagogies, who are involved in social work, or trying to help community or assist community in any which way is possible. I wish you, I really don't want to take a lot of time, because you have two wonderful speakers here who are going to benefit participants immensely. And Mary, I would say that take it forward and see how we can come together, Shastri as an organization, and you as a scholar who has hold on community work can come together and devise something beautiful that nourishes the systems, the processes, and the pedagogy that you are working on. Thank you once again. All the very best to all of you, and have a wonderful time together. Thank you.
Thank you so much for your kind words. And for those who joined us a bit later, I would just like to say once again, thank you so much to Shastri for supporting this webinar series and for providing the grant for this bilateral Indo-Canadian webinar series. Right now we have the first 6 months of the year planned, and it will go on from there. So thank you for attending this morning, for your words and inspiration. And we will—
Pleasure is mine. And I will leave here up to you to have the session to yourself. And once again, keep in touch with the Shastri organization. A concerned program officer, Ms. Reshma Rana, is here with us. Also, thank you, Reshma, for being here today. And she is able officer who can navigate your agenda very well with Shastri Institute. So remain in touch with her and with us. Anytime you want to reach out, you're most welcome. Thank you once again.
Thank you
Bye-bye.
so much.
Yeah.
Nandri, and Nani. Yeah, thank you.
Thank you.
Okay, so I will
Mary,
get
ma'am.
started.
Yeah, good morning. This is Kalyani. Yeah, before starting the session, our Shankar Raman sir also joined here. So let me introduce Shankar Raman sir.
Hi, everybody. I'm very happy to be a part of this webinar, and thanks to Shastri and Prachi for her wonderful words. Look forward to the session. Thank you, Mary. Thank you, Prachi. Thank you, everybody.
Thank you, Sankara Raman. Thank you very much. Okay, so we'll get started. Okay, so welcome to our second session. Today is our family-centered care topic, and we will cover everything from challenges to opportunities and stigma to empowerment. And on behalf of myself and Navamani, we welcome you. And once again, thank you, Prachi, for opening our session. And thank you for the funds and grant that we've received from Shastri. So the objectives today will be to look at recognizing psychosocial stressors of families of children with developmental disabilities. We will look at understanding the essentials of family-centered care. Then we will share some of the Amar, Seva, Sangam experiences in family-centered care in rural South India. And finally, we'll look at implementing responsive strategies to empower caregivers. So let's look first at the psychosocial stressors that families face when they have a child with a developmental disability. We know that the nurturing care framework that was developed by the WHO, UNICEF, and the World Bank Group looked at various components that are needed for early childhood development. They looked at that you need the good health, adequate nutrition, responsive caregiving, safety and security, and opportunities for early learning. So those provide us with the basics of what is needed for good early childhood development. So the family is key in this, this framework to the development of the child. Then if we look at the Center for the Developing Child at Harvard University, also proposed the 3 principles to improve outcomes for children and families. First, you need support that's responsive, we need to support responsive relationships for children and adults. We need to strengthen the core skills for planning, adapting, and achieving their goals. We also need to reduce the sources of stress in the lives of children and families. So those provide us with what is needed to really build upon what all the elements that we need for proper child development and enable family-centered care. So here we have the 3 principles that improve outcomes, where we have our support to support responsive relationships between families and their children. We need to reduce sources of stress, need to strengthen the family's core skills, and that will lead to children's healthy development and educational achievements. And we will also have adults that are responsive, providing responsive caregiving and economic stability within the family. So this is what we want to keep in mind when we look at family-centered care, or what the elements are needed to provide the best outcomes for children. So now if we look at, for those who know Bronfenbrenner's socio-ecological model of health, where how the context in which a person lives influences how they develop and health outcomes. We know that we have the intrapersonal, influenced by the interpersonal, and then institutional, and then influenced by the community in which people live, and then influenced by the policies that exist within the system. So if we think of parents around the world, they are influenced by all the different layers of the context in which they live. Now, if we look at child development, how a child in the center of the model lives within the family. Okay, so we have our child in the center, lives within the immediate family and is influenced directly by the family milieu in which they live. And then if we go to broader circles, we look at the kinship and informal networks. It could be neighbors, friends, cultural groups that influence the development and also the family context. Then if we go to a broader circle, we look at the local environment, the formal networks and services. It could be the schools, the transport, childcare, the local government, the health services. And then at the broadest level, all the broader economic policy, social and wider environment that influence the child and family, or at the national level, the economy, the policies, and in this situation, it could be the disability policies that are instituted. So we have to keep in mind that a child develops within a family, and the family lives within the context of their community and the broader level of the environment. So if we look at a study that was published in 2020, where they looked at the burden of caregivers of children with cerebral palsy. And it was a qualitative in-depth interviews amongst mothers of children with cerebral palsy that attended a physiotherapy facility in rural and peri-urban areas of Tamil Nadu. And they looked at the transcripts of their interviews based on the social ecological model that I just shared with you. And so they were able to analyze the psychosocial burden amongst these mothers. If again, these often remind me of the burden that parents of children with disabilities often are faced with. And so this study seek to look at what are those psychosocial stressors. So the stressors of caregivers in this study were based on the socio-ecological framework, as I said, and they looked at various levels: the individual stressors, the interpersonal stressors, the community level stressors, environmental, and health system and policy stressors. So looking at the individual stressors of these mothers with children with cerebral palsy, and these are from the study that I referred earlier, where the physical ones were the burden of work and the lack of rest, the physical aches and pains. At the emotional level, there was guilt, blame, worry regarding the future of the child with a disability. The social level was blamed by society on the parents. Financially, they were unable to work. There was the financial burden borne by the individual, and informational was the lack of knowledge about caregiving options. Looking at the interpersonal stressors on the physical side, these mothers reported in the study abusive husbands, lack of physical support, inability to give good care for their other children. On the emotional side, they reported emotional abuse by their spouse, There was the guilt of not being able to care for their other children. And social was the blame by society that they were not caring for the family. Looking at their community level stressors, on the physical aspect, they reported no physical support from community members. On the emotional side, they felt a sense of isolation in society. And on the social aspect, they felt discrimination in society. So I'm just putting this slide there because if we look at what these mothers reported, both on the personal level, the intrapersonal level, and the community level, they reported various elements of what we would call stigma, the shame, the feeling isolated, the lack of support, discrimination, the loneliness. So just of these words seem to resonate at various levels with these mothers. Now, if we look at their environmental stressors, there was physical accessibility barriers. They had difficulty in public transport facilities. They were worried about how to get around with the child. On the social aspect, they felt there were non-inclusive spaces in their environment. And they also have reported a lack of job options that helped the caregivers have that had the flexible hours for caregivers. And finally, at the health systems and policy level, stressors, they lacked social support groups. Financially, there was disability welfare support they felt was insufficient. And informational, they lacked the support groups and information. So these provide very interesting information about what the psychosocial stressors are of parents of children with disabilities. And again, just to reiterate, this study was done in rural or peri-urban areas of South Tamil Nadu. So now I will, with that in mind, now that we know what the psychosocial stressors are of families that we deal with, and of course they are different depending on the context in which people live. It varies with each family. It's really an individual system. So we will look at what the essentials of family-centered care really are. So families come in different shapes and sizes. We have nuclear families, we have joint families, nuclear families, we have single parent, we have families that have only one child, some may have two children with a disability. So just a reminder that families come in all shapes and sizes, and each family is unique. So what are family-centered services? So it's a philosophy or method of service delivery that recognizes parents as the experts in their child's needs. Parents are the ones that are with children. They know their children's best. So they are considered the experts in their needs. And family-centered service promotes partnerships between parents and service providers. It supports the family's role in decision-making about services for their child. So what do we actually mean by family-centered service? It's based on three different premises and guiding principles. The first premise is that parents know their children best and want the best for their children. So that leads us to the guiding principle for providing family-centered service, that parent involvement is essential in decision-making. Parents should have the ultimate responsibility for the care of their children. So just to define the shared decision-making, and it's really a partnership between the parent and the therapist for looking at the point of views of both, defining the problem, ideas for solutions, and making a decision on best approaches. Now, the second premise is that families are different and unique. So each family has their own needs and challenges, and also can provide differently to their child. So the guiding principle is that each family and family members should be treated with respect as individuals. Our third premise is that optimal child functioning occurs within a supportive family and community context. And that brings us back to what I referred to in the first session, in the first part of my session, that we need to consider the child within the family and within the community context. We know that the child's affected by the stress and the coping of the other family members. So then that leads us to the guiding principles that the needs of all family members should be considered. And the involvement of all family members should be supported and encouraged. So child and family are a unit. So these are the 5 core principles of family-centered care that have been defined by King and Rosenbaum back in the late 1990s. First, respectful and supportive care. Next, coordinated and comprehensive care. We have enabling partnerships and collaboration with families. We have providing specific information that families need and providing general information. So does family-centered service make a difference? Well, we can look at many outcomes of interest, and we know that family-centered services make a difference both at the children's physical, social, emotional, and cognitive functioning, as well as the parents' level of stress and worry. We also know that parents' satisfaction with services are greater with family-centered services. And we know that outcomes, it's been shown positive outcomes for siblings, the family itself, healthcare providers, service organizations, and community as a whole. So the outcomes of interest with family-centered service are broad and far-ranging: children, family, organization, and community. So this is just to outline, again, the interrelationship of services and outcomes for children and families. So by supporting the child and supporting the family's concerns and needs, and setting goals and priorities that address both child and family together, and providing the needed resources, we address both the child and the family in terms of services, so child-focused services and family-focused services. And that will lead to best child and family outcomes. So this is how we should think, is always think of both outcomes as a priority when we offer services. So family-centered service is a best practice, considered best practice in pediatric rehab, in early intervention. So we know that it's been shown that it results in greater parental satisfaction with services, better parental psychosocial well-being, and better psychosocial adjustment of children. So implications for families, parents and families, is that they need to discuss their beliefs and expectations and perspectives with service providers. They need to understand the expectations and constraints of service providers. They may need to learn new skills, and they experience more pressure to be involved at times. They may feel a greater sense of control. So we only have parents take on what they are able to provide in terms of the partnership. We have to adjust accordingly. Implications for service providers is that we have to look at what parents value most and what their beliefs are. We have to look at we have to think about what they value and what we value. The implications for behaviors is that we need to accept families' choices. We need to be flexible, provide individualized services. We have to develop strong partnerships with families, need to develop new skills. And we have decreased pressure to have all the answers, because it really should be a problem-solving approach where you try to find the answers along with the families. And the implications for the organization is that we need to devise and design programs and services that are family-centered. Parents are more satisfied when services are delivered in a family-centered manner, and we need to develop a family-centered culture. So the organizational context affects the implementation of family-centered care, and thereby individual client outcomes, philosophy, and practice. So it's really the whole organization, the service provider, the family needs to be have a full culture of family-centered care at all different levels. So again, family and healthcare provider partnerships. We want to enable the partnerships. We want to provide services that are responsive to individual family needs and priorities. And we want the engagement of the family in the intervention process. Now, looking at a study that was I was very pleased to be involved in and to co-author, looked at perceptions of family-centered care amongst caregiver of children with cerebral palsy in South India. And it was done in the state of Karnataka. And they did semi-structured interviews of mothers of children with cerebral palsy. And they looked to map, the categories and the themes to look at the relationships of how parents perceived family-centered care. And it was looking at the various levels of caregivers' life, the enabling and partnerships. It looked at information provision, the coordinated and comprehensive care, and respectful and supportive care. So looking at what emerged from the study was a theme that took us a new importance there was the caregiver's life. And that was a theme that hadn't emerged in previous family-centered studies, was a theme that highlighted the caregiver's own physical and mental health needs, the family roles of these mothers and their well-being, and also the needs to integrate like the onus of care with their household responsibilities and also their limited participation in their own personal activities and the social isolation. So again, this study reiterated the findings of the first study that I reviewed. So this is a new theme that emerged in the family-centered care. These mothers reported that they had respectful and trusting relationships with care providers and health professionals, but that there was limited coordination of care. There was sporadic partnerships and limited opportunities for shared decision-making. So we can see that the implementation of family-centered care was not fully developed at this point. So there was a desire from these mothers to receive more specific information about their child's progress and prognosis, as well as general information on community resources and the need for empowerment and support groups. So this is a busy slide, but this is a wonderful thematic mapping that was developed in our study that looked at all the various themes that came out of family-centered care. And at the center of it all were the various themes of caregiver life at the top, all the various elements of the caregiver's life that is a new theme that has emerged in this family-centered care framework. And we have enabling partnership to the left with all the various elements. The yellow component is the coordinated and comprehensive care with all the elements of what is involved. The information provision that is both general information and specific information about the development of their child. And finally, to the right in red, the respectful and supportive care. So if we look at the practical implications for these findings in family-centered care in the South Indian context, we can see that we need to recognize the unique caregiver needs and expectations, and that we need to think about looking at it from a cultural perspective towards child disability. We need to think about the impact of societal stigma, values, and traditional beliefs. We also need to look at attitudes towards medical professional, which often what was reported was doctor knows best, medical professionals are the ones that should be developing the program, but we need to develop further the partnerships with the professionals. And we need to consider the life stressors and also gender responsibilities, where it is often the mother who takes on the role of caregiver of a child with disability. So we've got additional family-centered reference that I referred to. And now I will pass it on to Navamani, who will report on the experiences of family-centered care in rural South India and share the Amar Seva Sangam experiences.
Yeah. Thank you so much, Marie.
Welcome.
Now I'm going to explain about our experiences in the rural South Tamil Nadu. Our community-based program is in Tenkasi, Tirunelveli, and Thoothukudi district, and we are reaching about 3,000 children and their families. And I'm heading the program in the Tenkasi district. So while implementing the family-centered care, what are our experience? So I'm going to share with you that one. Being the community-based program, the scope of our program itself is the family-centered care. In our society, where medical model approach is prominent, generally the service providers, doctors, therapists, or the decision makers, they decide about what to do for the child. If parents are educated, service providers would explain the therapies and the effects of the therapist. Discussing about what is the priority for the child and the family will be the whole new experience for the families. Many times when we open up about the goals, discussing the goals for the child, the families would express like this: you know about our child very well, so you please tell us what to do. So this is the expression which we get from our families. Ideally, in family-centered care, all the family members that are supporting the child is expected to participate. In our home-based early intervention and rehab program, many times primary caregivers would attend the session. So we may not be able to get other family members' expectations and participation, but we try to maximum participation of the other family members. This may be because due to the primary caregiver in our situation, the mother usually has the guilty feeling of having a child with disability. As Marie said, there is a feeling of stigma. So she would not ready to discuss and involve other members, which is very common in early intervention setting. Here we focus on parental counseling and trying to connect with other members of the family. While trying to connect with other members of the family, there may be a lot of resistance to join in the conversation from the family members. Sometimes even trying to talk to the other family members has also led to the discontinuation of the therapy services. So we really need to be very careful while dealing with the relationship between the family members. Each family member have different levels of interest in the child's progress and well-being. Not everyone in the family have the same level of interest in the child's progress like the primary caregivers. But engaging with all the members in the conversation itself would be difficult at times. Cooperation and follow-up. While discussing, the family members would be open and willing to do things, but the commitment may not be strong as the primary caregivers. After some time, the primary caregiver would face frustration. So a constant check and motivation of the family members is required. Next slide. Now, what are the challenges we face from the rehabilitation professionals? We are going to discuss about it. As I said earlier, all members in the family may not have same interest. Few people may be very negative about the training and the sessions. Connecting with all the family members at times may be frustrating for the rehab professionals. So they should develop the skills in addressing the different family members politely as well as firmly. In fixing the goals, usually the rehab professional fix the next developmental stage as goal, as it is easier and also to instruct the families. But in family-centered care, we are discussing with the families and get their priority. It requires a lot of skills. Initially, our staff also struggle to discuss the goals with the families and involve them. This is another area where the professionals needs to develop their skills. Rehab professional focus is understanding the family as a whole is very important. What is the word spoken and what is there in terms of financial situation, decision makers, who is the decision maker in the family, family relationship and dynamics, etc. They need to understand this one. When we need to address the needs not directly related to the child, but maybe linked with the child's rehab. For example, a child needs a mobility device. If the family cannot afford the device, we maybe need to organize those devices by organizing the funds. We are working with the community who are rural poor, just at the marginal level. The families which do not have enough to eat and have somebody sick, their priority would be to address those needs. Intervention for the child with disability may not be their priority at that time. In those situations, we refer them to the suitable support services wherever possible. We have also referred caregivers for the income generation activities and vocational training in these regards. So the rehab professionals who are working with the families, they may need to understand holistically and have enough information about the developmental support in and around their place. Towards the family-centric care, we may be addressing the financial needs, advocacy, and the family needs, which requires a lot of efforts and work from the rehab professionals. But we measure the output, it is usually the progress of the child. So the efforts and the time taken for these processes are not adequately measured. Next slide. So what are the opportunities we had while implementing the family-centered services? The families are now more open and discuss their concerns like financial and other commitments with respect to the child's rehab. They are able to express their needs and family's interest on the child. If some suggestions are not feasible, they are open to discuss and come up with alternative solutions also. There is a progress in relationship between family and the professionals. Family members' involvement. Family members where only the primary caregiver was working with the child. Due to this family-centered care approach, other members also confident to work with the child. This is one example I can say. A young child where the mother is the only primary caregiver feeding the child, and the others were not confident in dealing with the child. In the family care services, we we trained the aunt and the grandmother to take care of the child. So they got the training and also now confident to feed the child and caring. And the mother is now little free. Also, the understanding about the child's condition and handling technique have improved. Confident on the services. Families also have improved confident on our services, better understanding, so better acceptance of the child. Now, the entire family is involved. The participation of the child within the family is improving, and the family understand the child's need. They advocate for their child outside, that is in the community, more confidently than ever. Next slide. With the rehab professionals, what are the opportunities we are having? They are able to set realistic as well as participatory goals with mutual discussion with the family members. They are able to discuss things beyond normalcy, that is focusing on walking, talking into mobility and communication functions. Since we address the family holistically, which requires collaboration between professionals, like earlier, the physiotherapists, special educators, and the other professionals would be working slightly differently, but now they are working together as collaboratively. So a strong transdisciplinary approach is evolving. Family members are observing the progress of the child keenly than ever before, and so they ask for clarifications. Also, it provides opportunities to share the responsibility between different members. Suppose if there is a less progress than expected, they also can analyze together, like the family as well as the rehab professional analyze together for the reason for less progress instead of blaming each other. For certain things, families also come up with solutions, like how to go about it. When the rehab professional stuck, the families give solutions. Respect to the service provider have also improved in the families. Next slide, Marie. Yeah. I'm going to explain one or two children which we worked with and have good family-centered care. This child is Anbu Selvi. She has a Down syndrome. The family members are mother, father, grandmother, elder sister. Initially, we discussed with the mother. The mother said the child is fairly good in self-care, and it is the age for schooling, but she was not open for the to send the child to the school. So we involved the other members. While the first time when we meeting the family, the other members were mother, grandmother, and elder sister. Father was not there. So while discussing the family's concerns, we realized there are other things more than education. There are so many things come up. This child loves to play with locks, and she locks herself in the room and toilet. So there is no locks in their house at the toilet. So due to safety concerns, parents do not send her to the school. So if she locks herself into the school room, so it will be difficult. So they are not they don't have interest in sending the children to school. Also, this child loves to play with the children, but since she has difficulty in understanding the rules in cooperative play, so she was not able to continue the play. So she generally stays at home. So somebody has to be there in the home to take care of her. Also, she does not able to differentiate strangers. So if somebody called for a bike ride, she would go happily without knowing whether they are strangers or whether they are known person. Due to this, the family always somebody will be there with the child. So in the family-centered approach, so we discussed with the grandmother. So she was very happy to take care of her, teaching her safety within the home. We explained her how to do it, but the grandmother was very happy to take that one and involve her elder sister towards cooperative play with others. Mother teach her specific self-care skills and motivate other members or how they are going about it. Now, after the COVID, now the school is open. So we will be working with the school management to improve the safety aspects in the and inclusion of Anbu Selvi in the school. Next one. Mari. Yeah. The next child which we are going to see is Sumati. She has multiple disability, mainly vision, hearing, and intellectual disability. Due to her disability, her father abandoned the mother. So mother has started developing the mental health issues. So we gave counseling to the mother. As a part of the intervention for the mental health, we also organized some on-the-job training. But during that initial period, she was not paid, but as a voluntary work she was doing. Gradually, she got confidence and came out of the stress, mental health stress. So now she is working as a peon in Canara Bank, BK Puram. In the meantime, we also trained the grandmother to give training for the child. Now the child is going to the school. We are doing the follow-up at the school. Next slide, Mary. Yeah. No, one slide before. So what are the family's voices? Family says there is an increased involvement of family members other than primary caregiver. This is the voice of one primary caregiver. Initially, the primary caregiver was working. Now the family members are involved. No, the latter. Next one. Next one. Yeah. Now the child's condition is better understood by all of us in the family and so confident in therapeutic intervention. Next slide. Next. Yeah. So now I'm going to explain the challenges at program manager level. Mari, the challenges at program manager level. The slide. Yeah, thanks, Mari. What are the challenges I face as a program manager? Transforming knowledge into practice. When we say family-centered care services, the rehab professionals would happily say, though we know those things, but practicing the real family-centered care into the community. And sometimes they have the tendency to forget and follow the same earlier method. And motivating the staff to follow the family-centered approaches because it requires a lot of effort. So motivating all the staff around the program is very difficult. In that, we also have to have clear guidelines and monitoring the process and adequate guidance and support. If we say family-centered care services, which requires addressing the other needs, and if we don't give information, accessibility, and other support, then it is not possible for the staff themselves to do the program. Addressing various various needs. The last one is documentation of all interventions. In a family-centered care, the intervention for the child would be at least 50 or 60%, but the other interventions would be the other portion, which is not easily documented. So that is another area which we are facing the challenges. Next slide. So what is our progress? Saying this, we are doing the family-centered care with the challenges, with the opportunities. What is our progress in the family-centered care services? Our progress is about, I can say, like 50%. We are constantly improving our consciousness towards family-centered care. Actually, family-centered care service is not a new concept in rehabilitation, but practicing it all our services is the new effort. The second one is difficulty in addressing expectations that are not in our control. Sometimes the families ask for some expectations, which is not like we don't have the resources to support. We don't have the information to support. So that is another one challenge. Lot of efforts and slow process, because here we are taking the entire family with us. So there are a lot of efforts, but the process is very slow. In the meantime, we have to motivate the entire team to take the work forward and answerable for donors and other stakeholders. While we are doing the project proposals, we will have some activities and the budgets. Sometimes in the course of time, we may need to do some of the activities according to the family's needs. So, but we are answerable for the donors and other stakeholders. But still we are progressing in the family-centered care services. Thank you so much. Mari, you can continue.
Thank you, Navamani. Before I review our last section, I'm going to play for you the our Enabling Inclusion app video, so that you have, for those that are not familiar with the Enabling Inclusion model and app from Amar, Seva, Sangam, it's just a 3-minute video, so that I will introduce the Enabling Inclusion model and app, and then we will get into the implementing the strategies that Amar, Seva, Sangam has as part of the Enabling Inclusion program. So I will just get the video playing. Please bear with me. I'm trying to get the video. Actually, I will play it at the end, or I'm just trying to get it from my end here. Technology. Okay. I will get. I can't. Oh yeah. Let's just see. Do you see it right now?
Not yet, ma'am.
No. No, I think it's just playing for me. Do you see it now?
Yes, ma'am.
Okay. So just sharing our Enabling Inclusion app for those who are not familiar. And now I'm going to be reviewing the various components of the Amar Seva Sangam's Enabling Inclusion model that addresses family-centered care. And I will share back our presentation. Okay, so let's look at following in Navamani's footsteps of how we implemented responsive strategies to empower caregivers. Now, if we look at a multi-pronged approach that is needed to really fully develop family-centered care within the organization, is that we looked at the provider training, service provider training that was needed. We looked at child-focused solutions. We also have parent-focused solutions. And we also have community-focused solutions. And getting back to the first part of the talk, where we talked about the child within family and within community. So we need to address all aspects in order to fully provide the full family-centered services. So first, looking at service provider training, that is ongoing at Amar Seva Sangam and through the Enabling Inclusion program, is that we have capacity building training of the rehab specialists and the community rehab workers. So in the principles and implementation of family-centered care, there's also family-centered goal setting workshops and actual practical sessions of how to engage with the family in terms of collaborative goal setting, identifying the priorities and needs of the family, and looking at the family strengths and challenges within their daily context. And we really want to have discussions with the family about what their needs are on a daily basis within their daily routine. So it's collaborative goal setting. We also do a lot of participatory role playing to really develop the skills that are needed for a family-centered service and the problem solving involved. We also train the therapists in terms of the coaching approach with parents. So the idea is that we want to train the parents and coach the parents in how to provide best care and best developmental input for their children. Looking at changing the healthcare provider behaviors to meet the parent needs. We want to always review the child and family strengths and needs first. We want to respect each family's priorities in goal setting. Then we want to integrate the developmental goals within the daily routine. And we coach the family and provide the support and resources that are needed to carry out those goals and to be able to work on those priorities on a daily basis. As part of every session, the therapists are encouraged to set time aside for listening, informing, and advising. We need to invite questions and concerns from the families. So we need to have that time to be able to have that family-centered interaction with the family. And finally, we want to support participation of the child and family within their community. If we look at the child-focused solutions within the Enabling Inclusion model and app, is that we have a child and family ICF-based assessment that includes the context in which the child lives. We have an environmental assessment, and we also look at all the personal components, personal aspects of the child and family. We use the COPM, which is the Canadian Occupational Performance Measure, which is a family-centered goal setting tool, where we go through a day with a day in the life of the parent with their child. And we ask the parents, what are things that you would like your child to be able to do, but unable to? And where are things that we can help you with within your day? So we look at parents' priorities and goals for their child. And finally, we have a child and family care plan, which is an individual program plan that has the recommended interventions, but to address the domains and the skills that the parents wish to develop for their own child. And finally, the parent coaching is an important element of it. So here is the ICF-based child and family assessment, where we have family-friendly questions that we ask parents that deals with every aspect of body structure and function, the activities, all the ADL and everyday activities that their child is involved in for daily function, participation, environmental factors, and personal factors. So the family-centered approach is really built upon the ICF, and also, for those who are familiar, the F words within the F words for child development and child disability, which we will be covering in a future webinar. Yeah, so here again is the ICF framework and the F words, which really define what child development is all about, and our assessment and program plans are based on this. Now, if you look at our parent-focused solutions, we have various types of family support groups, parent participation meetings, family empowerment sharing groups. We have sibling groups. We also have one-on-one parent psychological counseling. We also support families' access to assistive devices. And finally, we support the child's transition to preschool and school. So looking at our family-centered goal setting, we also have the COPM, which I referred to, for the setting families' priorities and goal identification and parental perceptions of their children's function. And we also have caregiver measures within our Enabling Inclusion app that looks at the family empowerment scale, so the FES as part of the app. We also have the modified caregiver strain index. And finally, the caregiver child interaction measure. So those three caregiver outcomes measures are important to look at the level of stress and burden on the family and their level of empowerment. And very nice to track over time to see how the family is doing. So in terms of our parent knowledge and support groups, we know that it's essential as part of family-centered care to provide specific information about the child, as well as general information and resources. So we provide the understanding of the child's developmental delay or disability. We always seek to provide the information that the family needs to make the best decisions, and discussing the child's strengths and impairments. We also have parent handbooks in Tamil, promoting child development, handbooks on cerebral palsy, autism. We have some on activities of daily living. So those are handbooks which we hand out to families. We have parent participation meetings. We have also family knowledge sharing programs. And we hold programs on, some programs are held specifically on a Sunday to allow often the appas and the fathers to attend, and for the full family to attend these meetings. And finally, we have family guidance regarding the community resources and governmental schemes, such as the disability certificate. So in the intervention plan, as I mentioned, we use a coaching approach with parents, and then we use a train-the-trainer approach to train the community rehab workers that work with families. provision of assistive devices to enable independence within the home and community. And finally, we organize medical and surgical camps that are held in the rural districts to facilitate access to medical services for the families. So the coaching approach is really empowering parents in terms of the hands-on experience to facilitate their own child's development. So empowering parents to integrate the goals and the recommendation within their daily routines. So it's really it's not the therapist that does the therapy with the child, but it's empowering the parents to be able to carry out the activities and their own goals that they have for their children. And here we have an example of our family empowerment and advocacy group, where we work on group advocacy and parent support groups. And we have various types of self-help groups. And for these COVID times, we also had some social media groups for peer connection and mentorship. Yeah, so this will address the tele-rehab that we developed further in the past 2 years for both the early intervention follow-up and some video sharing to review goals and intervention review with families. We also developed WhatsApp parent groups. Some were by block, by neighborhood area, or some were by age ranges or diagnoses, and just for general information sharing. Then we had the Zoom parent meetings, and for those the families that do not have data, we had phone calls to reach out to families. And finally, looking at the community-focused solution for family-centered care, it's really the disability awareness programs that are held within the community. So we have the 3 types of programs, and those are also within the Enabling Inclusion app. We have the community awareness groups. We have some groups that are specifically for women and some that are for the school awareness program for children within the school system. So the purpose is to really disseminate knowledge about and understanding about health and disability, and to reduce the stigma and the attitudinal barriers towards people with disabilities within their villages. And the ultimate goal is to promote an inclusive society and schooling system. So our final outcomes, when we look at it, family-centered care does not arrive from one day to the next. It's work in progress, and it's really something that the benefits are great, but also it needs continuous work. But our final outcomes is that we develop parent and healthcare provider partnerships. We have been able to develop caregiver knowledge and coaching. We've been able to provide parent support and participation. And we provide diversity of services, both for the child, the family, and the community. It's a multi-pronged approach. And it's work in progress, but we are gradually changing attitudes and societal stigma. And we have improved caregiver well-being. And finally, last but not least, it's a full cycle. We have positive child developmental outcomes. So looking at the full spectrum of the outcomes of our program. And I'm just happy to share our 2 recent publications from the Amar, Seva, Sangam team about our program, as well as our caregiver outcomes paper. And I thank you for your attention. And Navamani and I will open it up to discussion and question and answer period. And I will stop our screen share. And we will be pleased to have questions that you may have. Maybe we can ask either that you raise your hand or maybe share it in the chat box. Maybe Celine can monitor.
I saw a question, Marie. This is about our measuring the outcomes of the children and the efforts we put. They asked about what are the our efforts towards that one. Shishu, yeah. This is actually while working in the community, we are actually collecting the information as well as the various types of intervention the staff are doing in the rehab program. So we are making it as a kind of compiling things and putting it into a various scales. It is in the process. Supports which is given by the community professionals in the rehabilitation process.
Katiki ma'am, hope your question answered by our speaker. Do you have any other question on that?
No, I just wanted to know if there was already a kind of a template or something like that. So as you said, Navamani, that you're still compiling it, and it would be good to know, because I think that would help document that extra effort that goes on. You know what I mean? What you mentioned. Yeah.
Yeah. The reason it's also it's not a single effort. It's multiple, and it is varying. Like it's a range of support. So compiling things and putting in order and having it as an evaluation tool, it takes some time, but hopefully we will be able to complete and share with all of you.
Okay.
Yeah.
Thank you.
Good morning. Sorry.
Sorry. So the question was measuring the outcomes of our family-centered care. Is that?
No, it was basically the additional work that gets done by the the service providers. So that's what I wanted to know if you've already got a template to map that. I was just curious.
Mm-hmm.
Yeah, and I just before Mr. Kempaya comes with his question, I just wanted to say thank you very much. This was very informative. I can see it resonates with what we are already doing. In fact, we are doing a lot of this work already, but it helps to look at it in how to say, like a very structured manner,
Yeah.
So that was a good learning. I mean, it was interesting to see that.
Thank you very much.
Systematic and structured. I mean, we are doing a lot of this, and we've been doing it for a while, but it happens in an organic kind of way when you're working on the ground. But to put it into a sort of this systematic kind of way.
Yes, and I find it's good to look at it from the service providers' solutions or point of view and training, and also what the organization must provide, and and what we are from the parents' perspective and from the child's perspective. The way we have organized it is we need to, like as you say, it's not so organic, but it needs to be systematic to see what at different levels and different levels of the system. Yeah. Thank you. I see a question from Kempai.
Yeah. Thank you, madam. This is Kempaya here.
Kempai.
So thank you. It was a wonderful presentation. It was a great learning for all of us. And we are from Caritas India CBR. We are promoting CBR throughout the country. In fact, in 18 states, covering all age groups. Of course, early intervention is a big challenge for us because we are working at the grassroots level. And I want to know whether you are able to develop any simple tools for screening the children for early detection that can be used by 10th standard, 12th standard CPR workers. And if they're available, are they available in different languages? And number two, we are also interested in the app, that inclusive app that you spoke about. We need to learn and we need to have programs. So how can you support us in this?
So your first question was about screening.
Screening tools in different languages.
Yeah, screening tools. Well, as part of the app, because we didn't address the screening, but we have two different screening tools as part of the app. We use the Trivandrum developmental screening chart, and the Trivandrum developmental screening chart can be used by various level workers. It can be used by community health workers, therapists. It can be done in various health centers. So that's one that we use, is the Trivandrum developmental screening chart. We also have the UNICEF child functioning module, the UNICEF Washington Group child functioning module that is within the app. And that one is one that can be used for children even beyond age 5 or 6. So we've got two different screening tools within the app that can be used by various health workers. Your other question was about if you wanted more information about the app, we can be in contact with you. If you, yeah, we have your information. Definitely we can provide, we can have somebody contact you to provide you more information about the app. We've got greater details and video, and we can provide you, answer your questions on that topic.
Thank you so much, madam. Thank you very much.
Thank you. Thank you. Any other questions? Yeah. There's a question that's asking, is this app available now? Yeah, it definitely is available. It is available through, you cannot just download it from Google Play. It's available through licensing with us through, so we can provide you with information if you contact us, definitely. And so it's an app that we support. We fully support the use. We right now have 6 or 7 different NGOs who have licensed the use of the app with us in a partnership. And we are growing again with various partners next month. We provide the training and the support for the use of the app. Any other question? Maybe I will just add my few words regarding family-centered care. Just my reflections of family-centered care is that I live in Ottawa, Canada, and I've been a physiotherapist since 1982, and I started working as a therapist before family-centered care even existed, when those words were unknown. And in the 1990s and later 1990s, the term family-centered care started becoming into existence. And the CanChild Center, CanChild Center for Disability, for Childhood Disability, in Canada, started much research into the actual framework for family-centered care, and many resources that I've shared were from the CanChild Center for Childhood Disability. And so it was a big change when family-centered care approaches and services came into being in the late 1990s in Canada. And I remember having to go through the processes of, and even training therapists into that approach. And so now what is being developed now and further now, like worldwide, is really the implementation of family-centered care and various at various level that is so important. And so I have seen how it's evolved through the years. And anyway, it's very exciting to have been able to share this with you today. So any closing thoughts, Navamani?
Yeah.
Marie and Navamani, it was a very good presentation.
Thank you so much.
Thank you, sir. Thank you.
Thank
And
you.
thank you so much, Marie,
I learned
for-
a little bit more today.
Thank you. And we will share the recording with all the participants, and you will receive a certificate of participation after you complete our feedback form. And we welcome you to join us for our next webinar, which will be March 26th. And we will put out the information for the next topic. And very pleased to have you today. And
Kapaya raised his hand.
I would like to, I'm interested to learn about the other people's family-centered care through the WhatsApp group. If you can share your efforts, because it will be like collectively we can document our efforts. So please share your experience in family-centered care, either before or after the sessions in the WhatsApp group. Thank you so much.
okay, thank you so much, everyone. Thank you for joining us. Bye-bye. Have a good day.
Have a good day for you.
Yeah, it's 1 a.m. I'm coming to you right now. It's 1 a.m. in Canada. So
Yeah, so very good early morning for you.
thank you.
Thank you.
Thank you. Goodbye, everyone. Bye-bye.
Thank you, madam. Thank you.
Welcome. Thanks. Thank you all.